How do you manage all of that?
Will not breathe, I guess.
Yeah, that's what it seems like.
It's not about me, it's about everybody in that group. Once that community is created, the community takes itself forward. The last time I checked, we had dentists in almost 100 countries. Nobody is a CEREC champion, nobody is a CEREC expert. We are all doing what it takes to get through the day. It was very tough, so about 250 people took it at one time, about 25 people made it. I called at 4 again. Have you filled that spot? Because I know there is one. And she goes, Doc, you're so persistent. I believe there's no harm in trying. The only thing that you cannot do is not try. You keep trying, you keep trying, you keep knocking on the door. The door doesn't open, you kick the door open.
Roseville, California. That's where I found myself this week on this episode of True Abutment's InTRUview. Now, this one's going to be a little bit different. Jay from our very own True Abutment, he's introducing us to Dr. Patel. Now, Dr. Patel owns Pleasant Grove Dental Group and Orthodontics here in Roseville. We're going to chat with him in his house. Then we're going to go to his office and meet his staff. I cannot wait. He is one of the most influential dentists and educators in the dental industry. We're going to meet him right now. Dr. Patel, thanks a lot for letting me come into the house here.
Absolutely, Jeff.
Inviting me over. This is beautiful out here.
Well, thank you.
You keep me here long enough, I'm going to make myself into the pool over there.
You know what? I think that's what we should have done. Just get in the pool. It's a hot day. Might as well, right?
How do you manage all of that? Because right now you're managing your practice, your family, a lot of other things going on as well as a 23,000 plus, community.
Will not breathe, I guess.
Yeah, that's what it seems like. Yeah.
Yes, it is a lot of work. I believe you are kind of pointing towards my Facebook group, Keep CERECing. Mm-hmm. We have a huge community of dentists who are members in that group, but again, that community does not depend on me to drive the community forward. Like you said, it's a community itself. It's not about me, it's about everybody in that group. So I have an amazing bunch of moderators in the group who on a consistent, on a daily basis, on an hourly basis are approving posts. And again, just the community itself, so once that community is created, the community takes itself forward. So there's a bunch of people replying to other people's queries at any given time. And we have dentists from all around the world. The last time I checked, we had dentists in almost 100 countries, representing 100 countries in that group. And the thought process was, if there was a dentist that had a query or a question at any given time, hopefully somebody is online to answer that query. And most of the questions, they get answered in like minutes, if not seconds. So it's the community carrying itself forward.
Why was that created? Where did that stem from?
So initially I thought there needed to be a platform which had an easy access for sharing ideas, asking questions, and although there were a few around, I wanted to create one of my own, especially with social media these days. Everybody's on Facebook, everybody's on social media, but there was just something that I always wanted to create and kind of be a part of and start something like this. And the thought came to my mind is like, so what do I call it? Do I call it CEREC Stars? Do I call it CEREC Champions? What should be the name? And honestly, when I was thinking about this, I realized that nobody is a CEREC star, nobody is a CEREC champion, nobody is a CEREC expert. We are all doing what it takes to get through the day and just kind of doing our best. And what that embodies for me is we're trying. And for me, CERECing is a verb. So you're doing something every day, whether you do it to the best of your ability or not. You're just attempting to do something, and hence Keep CERECing. You just share what you're doing on a daily basis and share it with the community so everybody can learn from it. I started the community, but to be very honest, I'm a learner, and every single day there are so many dentists in that group that I get inspired from, and I look at their work and I go, right? How do you guys do that? And it's inspiring because the next thing I want to do is emulate them and hopefully get closer, maybe even better. But that's a driving force. I always believe there is something to learn every day. And if I'm not learning, I'm not growing. And as the saying goes, either you're green and growing or you're brown and dying. And as a brown man, I can only be green and growing.
It's not an option.
Yeah, I can't get any more browner. I gotta get green.
Well, we've talked about where you came from, where you're at, where you're going, but I think we should go actually over to the office. I want to see what you built.
Yeah, let's check it out. Come on in, Jeff.
Well,
so
here we are.
Here's our practice. This is our reception area. Patients check in here.
It's a great welcome area. I like this. It's very inviting.
It's open, it's airy, a lot of light in here. That's Cindy and Mike. Mike's our office manager. Cindy is our benefits coordinator.
Okay, great. Nice to meet you guys.
Nice to meet you.
You walk in right here. We have our CEREC milling unit.
Milling unit, yeah.
Okay, been using it for 15 some years now, still going strong.
Of course it is.
Yeah.
It's gonna go forever.
So our office is set up as a square with operatories on either side.
Okay.
And as you walk, you'll probably see an operatory on the left. That's Dr. Joesting helping one of our patients right there. And this is our little hangout area.
Oh, so this is where you guys just hang, you get to be as a group and you gather in this area. I like this. I like the way that the office is set up.
It is a very efficiently set up office where you can just kind of go anywhere in the office you want and find your place back. I've seen a lot of offices where you get confused whether, hey, do I go this way, do I go that way?
Right.
So this is pretty much for patients. They just walk around the office and they can find themselves again in the same operatory again.
Got it. All right, well, let's keep this going, keep this through. I know there's a lot more to see.
So we have our prime scan here, our 3D printing stuff from Sprint Ray Pro, and that's our little curing unit. This area right here is one of the coolest areas of our practice.
Oh, wow. Look at
which
this.
is what we call the ortho bay. So we have a full-time orthodontist that comes to our practice, and most of the orthodontic patients are treated right here. It was kind of a cool mural to pick with, you know, somebody just on a surfboard right there. So
yeah, so how did you come up with this whole idea, this concept? I mean, from the floor all the way through up to the wall and the ceiling.
Well, I'm not much of a design guy. We were given a few options, like, hey, pick one out of these 3, 4, 5 options, and our team loved this as the best option, and that's what we picked.
This is great. I like this. This is a really cool room.
Yeah.
All right, what do we have over
going
this
towards
way?
this side, we will end the tour at our X-ray unit again, which is our X-ray unit / consult room. Here's where our CBCT unit is. We've had this for about a couple years now, and we've been doing a lot of usage for this machine, planning implants, just looking at pathology that wasn't seen on normal x-rays, and it's been a great addition to our practice. Patients love it. Our diagnosis is pretty much on point just because of the technology, what they show us in a 3D dimension versus just a 2-dimension x-ray.
Yeah, I mean, so your facility is fantastic, but you can't have a great working facility without a great working team. And what a team you have.
Oh, we've got a great team. We are a one-stop shop. We pretty much have every specialty under the same roof. So we have 3 general dentists, including me.
Okay.
We have 2 full-time hygienists. We have an orthodontist who's full-time. We have 2 days of perio. We have 2 days of oral surgery, and we have 1 day of an endodontist coming to our practice to help patients out who are in pain for root canals.
And we're going to be chatting with some of them right now.
In fact, you'll get to meet 2 of my associate doctors. We don't have any specialty happening today.
That's okay.
But you'll get to meet 2 of my associate doctors, Dr. Beatty and Dr. Joesting.
Awesome, I can't wait.
So I actually joined this practice last November. My husband and I moved across the country from New York in August, in the middle of all the pandemic, everything. So we drove across the country, moved here, and I was actually introduced to Dr. Patel through a friend of mine whose cousin I met in India. So dental world is very, very small. And I knew of him because he's very well known in the CEREC world. So I thought it was a really good opportunity, and we met and we clicked immediately, and then I started working here in November. So not as a child, but ever since college, I knew I wanted to do something working with people. And so I was looking into medicine for a long time, and I had a family friend who was a pediatric dentist who called me and was like, why don't you come over, shadow me, and see if you like dentistry at all? And so I did that, and her office was full of, you know, tons of screaming kids, and I loved it. And I was like, this is great, this is so much fun. And so I decided to transfer from medicine into dentistry, and then never looked back, and I've loved it since. My advice is you should never say never. You need to take care of your mouth the same way you take care of your body. Everything is connected. Our mouths are connected to our overall health. And when you have problems in one area, it will cause problems in another area. And I know that the dentist is scary. And I know that a lot of people come in here and the first thing they say is that they hate us. But once you find the dentist or the provider or the person that you connect with, it doesn't have to be that way. You can be comfortable, you can find what we call a dental home and make it your own.
I had been in contact with Pacific Dental for a few years, and then I kind of was with another practice in Stockton, and then I talked to the regional manager here, and he was like, oh, this is great practice. And actually one of the hygienists was telling me about this practice that I had met separate from here. And she raved about this place, and I was like, well, I gotta at least look at it. And then I met Dr. Patel, and one thing led another, and here we are. So I've been, since we opened back up after the necessary shutdown. So it's basically been almost a year to the day, because I had moved from the Bay Area to here. I'd mostly practiced in San Jose. More than anything, the ability to communicate and to care about patients. I would think it would be easy for people to not dentists to not look at people as teeth, but that can sometimes happen, especially when things get extra busy. So to really sit down, take the time, especially when we're busy, and to think of the person, be empathetic, and really look at what the patient wants as much as what you know is best, but put that in the filter of what the patient is looking to get out, what's most important to them. For me, it's seeing children and seeing a child that might be scared at first, talking them through it, getting them to understand what we're trying to do, and then at the end, them being excited to come, the opposite of scared, actually happy to see me, talking, breaking out of that shell. To me, that's always been the thing I remember the most, those patients. I could do a crown, a filling 1,000 times. Those tend to fall away, but for me, it's the children that break free from their fear at the dentist. That sticks.
Where's
All right in the front.
One, two, three. Thank you.
Here we go, one more. Come on.
I don't know where to look.
I know.
And Dr. Patel, we wanted to give you a gift.
Oh, thank you.
From the staff. Thank you for all you do for us.
Really? Thank you. Thank you, everyone.
You're the best.
There you go to open it.
Yeah.
Oh, wow. Thank you. Thank you, guys.
Very good.
I appreciate that. You put the awe and awesome, the wonder and wonderful, the extra and extraordinary. Thanks for being so great. Thank you very much. Thank you, everyone. Thanks for doing this.
We love you, right?
What a journey you've had getting to this point. I really appreciate you letting me come over to your house, checking that out, and then also coming to the facility and sharing all the knowledge that you have. It's been incredible. I appreciate it.
Well, thank you for having me on the show, Jeff. I mean, True Abutment has been a great partner in everything that we do. And this whole thing has been amazing. I feel very honored that you guys chose me to be in this episode, and it was great working with you.
Yeah, you as well. And I'm going to come back some other time when I'm back in Sacramento.
Yep.
All right, see you later.
Come by to get your teeth fixed, man.
There you go. There you go. You know, I said at the beginning of the episode, one of the most influential people in the industry across the United States. Until next time, I'm Jeff Kraft. We'll see you again some other time. want to jump into how this all got started, because your journey, everybody has a journey, every dentist has their own story on how they became a dentist, but I want to hear yours. What made you decide to jump into this industry instead of so many others out there?
Well, so I was born and raised in India. I was always wanting to go into the medical field, so I went into dentistry. I graduated from dental school in 2002 in India. And then my goal was to always come to the United States because I had family here and my parents had already immigrated to the United States. So when I came here, I found out that the only way I could practice dentistry in the United States is if I went back to dental school. And this was a very tricky time in my life because I had just lost my dad to cancer. And I was in a bad space of mind. And so when I came here, there was another way to get my license here is if I took this test, which was called the bench test in the state of California. And if I passed that test, I could take the California board exam and eventually get my license. But my luck had it, and that test that was supposed to be taken, the bench test, the California board had shut the test down. They were no longer taking the test, and as a result, my only option was to go back to dental school. But there was some hope because there were about 3,500 applicants, me included, were promised at one time that we would be tested for this test. So there were 3,500 people making a lot of noise and putting a lot of pressure on the dental board. And eventually the dental board said, fine, we will retake this test for you guys only. We'll give you a couple tries to see if you can crack this test. If yes, then you can take your California license board and practice in California. If no, you go back to dental school. That sounded like a great deal until I found out. I got a letter from the dental board saying, hey, you're eligible to take this test. And I still remember this day. This was November 2004. And it said, you're eligible to take this test, and your estimated time to take this test would be November 2009, because I was one of the people in the waiting list that was on the rear end. So I was about, my number was 3489 out of 3,500 people. And here I'm thinking to myself, I have to wait for this test to be taken for about 5 years, not knowing whether I would pass this test or not.
Yeah.
And this test had a reputation. It was very tough. So about 250 people took it at one time, and about 25 people made it. Not because the rest were bad. It's just that California only wanted to allow a certain amount of people into the workforce. And as a result, the other people had to go back to dental school. So I got this letter and I'm like, okay, well, I'm not gonna wait for 5 years. I continue to apply for dental schools. But while all of this was happening, I was working for a dentist in Southern California, in Colton, California, where Dr. Michael Duggan, he used to train foreign graduates to take this test. So I was not only training with him, I was actually working at his institute as the sole guy doing everything. I used to clean up the tables for the students coming in. Once they were done, clean up again, set up for the new course coming in. And his courses were so popular that his courses would sometimes go 24/7. And I was there all the time setting up for courses and learning at the same time. So one fine day, one of my buddies who was supposed to take that first test in November 2004 came to the institute to buy some supplies. And I started talking to him, and he told me that he was so nervous taking this test that he actually withdrew his application.
Really?
Yeah, because he wasn't confident enough that he would make it. And had he failed the test, he wouldn't get another try for 5 years. So he wanted to take some more practice mock-up tests and then apply for the real one. So when I found out that he actually withdrew his application, I'm like, there's an open spot. The test was in 2 days. So I called up the Dental Board of California, and this lady answers the call and says, I said, hey, I just found out that there's an open spot for this test. Can I actually take the spot? And she said, we don't have an open spot. She hung up. So it was about 3 o'clock on Thursday. The test was on Saturday at USC in Southern California. I called back at 3:30 again. I said, listen, I know there's an open spot. My friend withdrew his application. Why can't I take the spot? And she goes, well, you know what? Even if there was an open spot, we cannot give it to you because there's a waiting list. There's a protocol that we need to follow. And honestly, there's no open spot. And she hung up again. I called at 4 again. And I said, have you filled that spot? Because I know there is one. And she goes, Doc, you're so persistent. And she goes, actually, you know what? There is an open spot. And if you promise me not to tell anyone, I'll let you take the spot. Like, I'm not saying a word. So I said, what do I need to do? And she goes, well, you have to be here at the dental board in the next half an hour because we close at 5, pay your fees, and you're good to go on Saturday. I'm like, I'm in Southern California. I cannot fly to Sacramento in half an hour and pay my fees. What are my options? She goes, then you're out of luck. I said, can somebody else do it on my behalf? And she goes, that's fine. So my uncle lives here in Granite Bay, which is very close to the dental board in Sacramento. I called up my uncle and I said, hey, you know what? This great opportunity has come by, and would you just go to the dental board and do this for me? And I've got great family support, and my uncle was happy. He was actually driving to the airport for a family vacation or something, but he kind of got out of his way, went to the dental board, paid my fees, and I took the test on Saturday. I passed the test, and this way I didn't waste 5 years of my life waiting for that test. That's how I actually got my license in California.
I mean, that story right there, I mean, most people come up to that concrete wall that is so high, it's not an option. This is not going to be possible. The intimidation of just the test alone has people bow out. Where did that come from? Where did that drive and persistence come from? Does your parents come from them, or where did that motivation come from?
Life circumstances. When you are against a wall, you got to do what it takes to get over it or break through the wall. I mean, I believe there's no harm in trying. The only thing that you cannot do is not try. So the worst thing that can happen is, you're going to get no for an answer. You keep trying, you keep knocking on the door. The door doesn't open, you kick the door open.